June 18th meeting of the Human Services Committee to order. I'd like a motion to approve of the minutes of May 15th.
So moved.
Is there a second? Okay, all in favor?
Aye.
Okay, approval passes. And now we have privilege of the floor. Is anyone here to speak to the privilege of the floor? Okay, seeing no one for privilege of the floor. I'd like to go to item number 1, which is basically, to renew and amend Resolution 61-24, amending the 2024 budget to implement the Women's Shelter Project within the Chautauqua County American Rescue Plan Act, ARPA spending plan.
Jennifer Swan, Budget Director for Chautauqua County. So we are just submitting this amendment. This was already an approved resolution. We just need to strike out the budget amendment piece of it. The funds were already rolled forward. What this resolution was actually needed for was simply for repurposing of those funds to the Women's Shelter Project. So we just wanted to correct that and get the official version on the record.
So it's just adding a whereas and
Yeah, it
And
just,
just-
it just acknowledges that the funding is actually already in the budget. So the resolution was really only needed for the purpose of repurposing the funds. They were originally allocated for essentially a quarantine shelter during COVID, and it didn't end up coming to fruition. So the funds were requested to be repurposed for the women's shelter instead. But the funds were already budgeted in the right place, so the amendment piece was not needed.
okay. Any questions, concerns? And this will come before the full legislature meeting next week.
Yes,
Okay. And we require no action today.
correct.
Okay,
Okay, thank you.
thank you. Number 2 is proposed resolution to authorize lease of Dunkirk office space for the Chautauqua County Office for Aging Services.
Dr. Mary Ann Spanos, Director, Chautauqua County Office for Aging Services.
Dana Corwin, Deputy Director, Chautauqua County Office for Aging Services.
So, as you may or may not know, we've been seeking a new location for our Dunkirk outreach office. We are currently located in the Dunkirk Senior Center at 45 Clipstar Drive. We had originally planned to move in with social services when they relocated to Lucas Street. That kind of fell through as the merger for mental health and social services came to fruition. They needed more space and they didn't have enough space for us. So we have looked at a lot of different places around Dunkirk. We already have a relationship with the Chautauqua Center in Jamestown, and it's a beautiful place where we're at on the second floor in Jamestown in that new building. Also being co-located with the federally qualified health clinic really gets us access to the people that we really need to serve, those most in need, low income, minorities. The current space, it's not HIPAA compliant, paper thin walls. You can hear what is going on with the seniors, and unfortunately, I think they probably hear what we're saying too. It also is a small area. We've been growing. Senior population is growing. When I came, I think we were less than 30,000 seniors. Now we're over 38,000 seniors. So our services are growing, And we really need a better space to serve those people. So we'd be going from like an 800 square foot footprint to about 1,800 square feet. 8 offices and a small conference area where we can hold support groups or do counseling sessions for, families or caregivers. So we've got a really great rate of $12 a square foot that Chautauqua Center has offered us. They really don't want to make money on us. They just want to cover their expenses. For this lease, though, they did ask in Jamestown when we leased that space, they financed the build-out over a 15-year period. And they didn't want to finance the build-out in this space. It's not a total build. There are some walls, but we do need some renovations to take place. So what I've given you is we went 2 routes. I, of course, had Buildings and Grounds and IT look over the space, get us some quotes. If the county went with their county contracts, the total renovations for this Dunkirk office space would be $110,668. So I approached the Chautauqua Center because the county, of course, has to pay prevailing wages, and that's what really makes it go up in cost. So they agreed to do the renovations. There will be some costs that aren't covered in the renovations, so they're in the lease agreement it says up to $75,000, and that pretty much covers the scope of work that was going to be done by Casey Contracting, Jamestown Mechanical, and Beck Electric, and maybe a little bit of flooring in there. The IT and Buildings and Grounds costs, we'd have to do because we do need the internet connection. Pucci flooring, that's kind of a max amount that we would spend. So that's where we are. We do, we've been very fortunate to have a lot of ARPA funds over the last few years, so that we have not been spending our regular federal funds. We have a lot of carryover funds. We can absorb this cost at this time for the build. We did ask for a 10-year lease rather than a 15-year lease. Not that I don't prefer a 15-year lease, but it's my understanding if we went with a 15-year lease, it would need a local law, and there's a waiting period, I think 45 days. I don't remember what it was. There's nobody from law here, but it's several months. So this way we could, if you all agree to this, and the resolution passes, we could get started on construction sooner rather than later and get into the space sooner. But we certainly want to be there long term. We've been 30 years at the space we're in currently, so hopefully we'll continue 30 years in another space.
So you're anticipating upon approval to start building out immediately and then a
Yeah, we
fall-
can't really occupy the space until
Right.
we finish the,
like fall move-in or something?
I
like
hope
that?
so,
Okay,
yeah.
Okay. What is the current lease? Do you know? This one's $12 a square foot?
I would have to look back. It was with the city of Dunkirk. We actually nixed their lease a couple years ago because we were having so many problems with, heating and cooling, and so we haven't paid them anything in the last
Oh.
couple years.
Okay.
We got them $750,000 to renovate the whole senior center, and they returned that to the state.
Okay. On item number 4 in the resolved, it says it's not to exceed $75,000, so I'm looking at the handout you just gave us.
Yes,
That's for the Chautauqua Center.
That's for the Chautauqua Center to do the work. I had an engineer spec the job for us, and we sent that out to the construction companies. We sent the same information to the Chautauqua Center. It's just, with the fluctuating prices of building materials, it may, hopefully that number is still a good number,
Sure.
but we would not exceed that without approval of the county executive.
Right, and unless approved by county executive. And then this $14,000 for the flooring and IT, and you're thinking,
Well, we
Unspent.
definitely need the IT
right,
and the painting and stuff that Buildings and Grounds is going to do for us. The 4,000 was a max if we put new flooring throughout. I don't anticipate that we're gonna do that.
yeah.
There is some flooring in there. It's older, but I think it could just use a buff and shine. So, but I wanted to give you all the possible costs.
But you think that's through the ARPA funds that were unspent?
Yeah, it's just 3B federal funds. They're asking, our ARPA funds don't sunset until September, but the state wants us to get those all spent. So what we're doing is spending all that money, and we can carry over our regular federal funds. So there's no problem, paying for that right now.
Any,
I do, Chairman. So right now you're paying no rent, and at $12 a square foot, at 1,800 a square foot, you'll be paying $1,800 a month, right?
Right.
Okay, so right now you're
About
paying.
22,000. We budgeted about 20,000
Okay.
this year for rent.
So that's already in the budget, even though you're not making those payments now.
Right.
Okay.
And we'll adjust it, as we go through the budget process. But
anything else, Susan?
No.
No? Okay. All in favor?
Aye.
Aye.
thank you very much.
Thank you. Okay, item number 3 is the acceptance of Tobacco Enforcement Program grant funding, ATUPA, Adolescent Tobacco Use Prevention Act.
I know.
Marty.
Hello, everybody. I'm
Hello.
Jessica Worsley, Director of Environmental Health Services. The tobacco, it's commonly called the ATUPA program. It's the Adolescent Tobacco Use Prevention Act program. It's a grant that we get from the state every year to do the enforcement of, the tobacco retailers within the county, ensuring that they have the appropriate signage, they're selling the appropriate products, making sure that they're doing all of the right things. It's a standard grant that we get every year. So this is just asking for approval to do it all again.
How much is that?
It's a 5-year grant. Annual allowance is $50,650. And we use it for staffing, we use it for mileage, reimbursement as we travel to and from these different facilities. Some basic like postage and things, because we have to send out certified mail when we find violations. We have to send them out certified. So some basic operating expenses. The large majority goes towards staffing.
So it's, you're doing your, sort of like when you do your restaurant inspections, almost like you're going into stores that sell tobacco and making sure they have the right signage and providing it and that.
Yeah, exactly. We get a list of the current tobacco retailers that are registered through the New York State Department of Tax and Finance. And then we take that list and we go around to the different facilities, make sure that they, are registered correctly, make sure that they have the right signage, and then we do the minor sale attempts. So they're not supposed to be selling to anybody under 21 years of age. So part of this grant is that we actually engage people under the age of 21 and go in and we send them in and they attempt purchases in those stores. And then if they are successful in those purchases, then there's a problem and there's a Board of Health hearing and legal action to follow up because the facilities are not supposed to be doing that.
Okay.
Does this include smoke shops?
Yes.
So is it, and I'm just asking you this question, but is it true that they're not supposed to be within so many feet of a school?
No, they are not allowed to advertise certain product, displays within certain distances of schools. So I know that there are a couple of smoke shops very close to at least one elementary school in the
Love.
Jamestown area. Yeah,
Across the street.
right. The regulations for Atupa require that they're not allowed to display products in the storefront, but they can have the word tobacco, they can have the word smoke shop, they can have those general terms, but they can't display specific products.
That's
I
a
know,
bummer.
it's an unfortunate loophole that they, yes. Yeah.
Yeah, okay. I wish that wasn't true.
Well, if the county feels so inclined to change that, they could certainly,
You can have,
look into creating local ordinances.
Really?
But they'd probably have to be grandfathered in.
That would be a legal question about what would have to be allowed and not be allowed moving forward, yeah.
Thank you.
You're welcome.
Anything else? Okay, all in favor?
Aye.
Aye.
Aye. Okay. Guess we'll probably see you in a little.
I was gonna say, I couldn't remember if I'm sticking around for the next one or not.
We'll jump to number 5 on the other category. Is Lacey?
yeah, she is.
Oh, okay, there you are. We'll jump to 5 for the late proposed resolution. She's gonna have a discussion too. Actually, as long as you're here, is it appropriate?
Do you want to do the lead resolution?
Yeah, can we do the lead resolutions?
Yeah, I'll send it in.
Do I need a motion to do that?
To change the order?
Change the order?
Motion to change the order.
Okay, we did in public
No.
safety, I didn't think we did, some of us.
You can do it as chairman.
I'm gonna change the order then, as chairman. We're gonna discuss these late resolutions that were handed to you. Where is mine? Okay. These are not on the agenda, but, guess we don't have an order, so I am going to say the first one will be authorizing public hearing regarding a potential application for 2024 Community Development Block Grant funding through the New York State Homes and Community Renewal Housing Trust Fund Corporation's Office of Community Renewal and the uses of said funding. Couldn't even shorten that up.
Well, if New York State would make their agency titles a little shorter, we could.
Okay, so explain to us what this is.
So we commonly refer to it as our CDBG well and septic replacement funding. It is essentially a grant program for low and moderate income folks to assist them with replacing septic systems and wells, and/or, correcting problems that exist with their existing systems. It is a grant that we have, had for many years, many cycles of the grant. We typically work with CRIC as a sub-grantee for this, and they take care of documenting income verification and that sort of thing. But we work hand in hand with them to, our staff go out and identify septic systems that are inadequate or failing, and then we refer them to the CRIC program folks to verify income, make sure they're eligible for the program. The system then gets installed under our supervision, just like any other septic system in the county. And then those, once that work is fully completed and documented, those folks, well, they actually never pay for anything. It all goes through the CRIC and the CRIC process, so the folks don't have to have any money out of pocket. It's purely through the CRIC process of them securing the grant funding.
Is there-
So,
Is
yeah.
there a ceiling on that dollar amount?
There's really not, because the septic system, I mean, the different requirements vary so much for these different systems. You know, what really bumps up the price tag on a septic system is if you have to get a professional engineer involved. We have never done a system like that with the CRIC fund, the CDBG funding. We've done conventional systems. But even those conventional systems at this point sometimes are maxing out at $25,000. So it all depends on, you know, the soil conditions, the size of the facility, the topography of the land, the depth of groundwater, all sorts of fun factors that can make your
Proximity to a
system.
lake
Proximity to a lake, yeah,
or a waterway?
yeah. Yeah, there's all sorts of factors to consider when installing a system.
Okay, any questions? Okay,
So, I do, sorry.
oh, okay.
So this would all be owners of property, right? So owners and then.
Correct.
It wouldn't apply to any rentals or anything, yeah.
Yeah, I mean, they have to show, and that's part of that income and eligibility verification that CRIC does, is that, you know, current on taxes and own the property and, you know, show financial need,
Okay.
yeah.
How many do you think, do you have any sense how many get helped a year?
Well, this will lead into your next resolution that you're gonna talk about. So I can tell you what we've, a general of what we've done with the money that we're just closing off a grant cycle for.
Okay.
We did approximately, well, we did 17 repairs. 5 of those were well repairs, 12 of them were septic system repairs.
With the thought that eventually you're gonna have a lot of improved water quality.
We're gonna
and
have wonderful
sewer,
septic systems
septic,
that
Yeah,
do all of the right things for all of the people they serve. Yeah, I mean, that's the problem. Unfortunately, you know, in our county, we didn't start keeping track of permitting systems until about the mid-60s. So there's a lot of systems in the ground that are complete garbage. And we find them, and then people can't afford the price tag to fix them. So this grant really helps us get good systems in the ground and helps people afford to, you know, stay in their homes.
okay.
Does it cover relocation, just in case their present system is too close to a neighbor's well, or,
No, it's only for replacing a septic system.
well, you're replacing
In kind.
it, but in a different spot?
What do you mean relocation of?
The septic on the property, if the current septic is too close to,
Right, so when we go out and we fail something, so the first step is failing it, and then the second step is meeting a contractor out there to help determine what a better system looks like and what a good system looks like. So that may be, yes, adjusting it from the north end of the property to the south end of the property, you know, whatever the property specifics allow.
okay.
Yeah, it's our opportunity to get in there and make it as good as it can be.
All right, anything else? All in favor?
Aye.
Aye. The next late resolution is to authorize the second public hearing regarding the implementation of the Chautauqua County 2021 Community Development Block Grant Funding Program, Chautauqua Septic and Wells, funded by the New York State Homes and Community Renewal Housing Trust Fund Corporation's Office of Community Renewal.
So this is, we're closing out our previous cycle, which started in December of '21 and is ending in on June 28th of 2024. We have to, wrap up all of our paperwork, finish all of the projects, make sure everything is done, which all of the projects are already done. But part of the grant process is to have a public hearing and actually share with the public what we've done with this money. So this second public hearing would be myself and Josh Freifeld from Crick would come and talk more specifically about what this sort of different demographics that we were able to assist in this program were.
Okay. Any questions? All in favor?
Aye.
Okay, thank you.
Thank you.
Okay. You're done, I think.
I came early. She's just my partner in crime.
For
I
lead-
think
for-
the next ones are mine.
Oh,
For
okay.
the lead
Oh, I'm sorry.
programs.
I'm sorry. I was expecting, for some reason I was expecting lazy. Okay. Another late proposed resolution to accept New York State Department of Health Lead Rental Registry Program Award and amend 2024 budget.
Yes, sir. So I'm Anna Powell, our childhood lead poisoning and healthy homes coordinator. And we, New York State has passed public health law that in communities of concern that are identified throughout the state, which ours is 14701, our Jamestown zip code, we're enacting a rental registry, a lead rental registry. So what that will entail is all homes built before 1980 that have 2 units or more will have to have a reoccurring lead inspection every 3 years and have a certificate that they are made lead safe.
And the state is providing
Yeah,
financial.
Right, so that's to accept
Assistance,
the
yeah.
money that they have given us to, use for staff, training,
And-
travel, equipment.
And you have a program in place to do this? Or is
We're,
there a
we're
template?
getting there. It will be another facet of our lead programs and building hopefully another team of people to be able to conduct these inspections.
Existing people or new people?
New people. We don't have the capacity to, so this will increase. I think the raw data that the state had sent us was a little over 5,000 units. So that will mean that our department will be responsible for conducting approximately 1,600 inspections a year. Our current staff can't do that
And
with
that's
all of our other
primarily-
programs that we're doing.
It's primarily in Jamestown, or is that the
Yes.
entire county?
Yeah,
I mean,
Jamestown.
It's that zip code.
14701 zip code.
That goes well beyond Jamestown.
Yeah. It's a-
Right, and so the state is also giving us the opportunity, because this is new in many of these communities, right? Like ours, we don't have anything like this yet. But we know the city of Jamestown really accounts for 75% of our lead poisoned kids. So instead of trying to do the entire zip code, it may be beneficial to really target to the city at this point. Again, that's all planning stages. But that's kind of where we're at right now. It's just all planning and budgeting.
You're just doing the city of Jamestown, not the rest of the county, or is the goal to do the?
Right now, the program is slated just for communities of concern across New York
okay.
State. And Chautauqua County's community of concern is that 14701 zip code. So it does touch, Ellicott and 2 other townships, I think. Yeah. So,
Yeah, a lot of the actual program of what the inspections look like, how often they need to be done, even the software platform that we're gonna be using, these are all state things that we are going to be given and guidance that we are going to be given. So there's some amount of this that we can figure out how it's gonna work best for the county, but a lot of it is very specific guidelines of what is expected of us and our staff to be able to complete what the public health law is now requiring.
Okay. Yeah, I've heard that, Jamestown is really ranked high for lead,
Seventh highest
exposure.
zip code in the state outside of New York City.
Which is remarkable, because we're a pretty small city, right?
Right.
Yeah.
Because I think they're 123rd in population.
123rd in population. Is it rate or is it number?
A number of kids.
Oh, wow.
Number of
So
kids,
that's
not
even more.
percentage.
Right.
Yeah, that's remarkable in a bad way.
Right.
Yes.
Yeah.
So we're happy about this public health law because
Sure.
it's an opportunity to prevent this stuff, not just react to it all the time.
Sure.
So we are excited about this opportunity. We recognize it's gonna be a lot of work.
Yeah, so it
But-
is a lot of work, but there's known models, like the city of Rochester enacted this 10 years ago, and they reduced their childhood lead poisoning rates by 85%. So we know this works. It will be a lot of lift, it will be a lot of enforcement and consistency with property owners and landlords, but essentially it's all to keep kids from being lead poisoned.
And in the super optimistic way of thinking, you know, if we can continue to fund home improvement projects, things that can actually address lead and abate lead and get rid of it in these homes, then potentially our number of 5,000 plus units can drop with the number of inspections that we have to do. They'll still have to be on a registry, but once they have actually done enough improvement to reduce the risk of lead being a hazard in the home,
Yeah.
then we can hopefully work ourselves out of having this giant number over 5,000.
It interests me because there's so many health problems associated with, lead poisoning and, you know, working in schools, I would see that, you know, with kids with, and you have a lot of kids with you have the combination, I understand, of kids who are testing high and also the presence of lead, right, in the
Yeah.
homes, yeah.
Yeah. So I would say 98% of the children that are poisoned in Chautauqua County are poisoned from their homes. It's not water, I mean, we might have a few occupational hazards where, you know, mom or dad are working in construction and they bring lead dust home on their clothes. But our kids are being poisoned in their homes.
Yeah.
So it's a housing issue and we need to, this is a great opportunity to really put some, you know, regulations and teeth behind our housing quality and increasing our standard here.
And do you have I know you're the environmental, but you have like a quick list of the kinds of things that happen when kids are poisoned with lead or do you have a quick list? Just because my understanding is there's a lot of developmental delays, a lot of the
Correct.
things that actually the county is trying to be helpful with in terms of public health. are
Yeah, so
coming
when we
from
have
those.
kids that are identified with lead poisoning, our team obviously reacts immediately. We schedule an environmental inspection, so one of our sanitarians will go out and conduct a inspection with an XRF in their homes. And then we also automatically send that kid to our early intervention team.
Yeah.
So we really have built a really great process with our other health department programs that, you know, if we have a child that's that's identified, they go right to early intervention. And then if they participate in our early intervention team, then they go directly into SHIN, and then they're tracked until they're 21. We also have a nurse on staff that can go and complete developmental assessments, nutritional assessments for these kids, right along with our environmental staff. So they're really getting, you know, we're focusing housing and care coordination for that child and what's best for that child and getting them all of those resources they'll need. Because sometimes, you know, symptoms aren't really forthcoming until a kid starts to attend school.
Yeah.
So sometimes immediately we aren't seeing them right at 1 and 2 with early intervention, but then by getting them into that program in SHIN, we can still continue to offer them services.
And I mean, my understanding of lead poisoning is that it's not like It's not like strep throat where you
No,
get an antibiotic.
it's not
and
in
it's
your
gone.
face.
It's like,
Yeah, it's really a sneaky
well, you
little
can't
thing.
fix, you can't fix
No,
it
and it's-
once you've been exposed. is
Right,
kind of what my-
right.
yeah.
It's permanent damage to that child, but it is 100% preventable.
Yeah.
Yeah.
How do
Chairman,
you do your inspections? I mean, how do you start? Walking down the street, say, let's inspect this house? I mean,
Well,
how does that start?
so we have we have another portion of our lead programs that we're able to go in and do prevention inspections. Again, that's all like voluntary basis. Most landlords don't want us in their house, but the tenants can invite us in. So we can inspect any home that's built before 1978 that has children under 6, a pregnant woman, or is a rental. That is that policy and procedure for our CLIP program
That's
is
a whole
what
lot of
it's called.
houses in 14701.
Right.
fall under
And
that.
so, in this rental registry doesn't, like, where our childhood lead poisoning program inhibits us to be in houses only with children. And our highest risk families are moving very frequently, sometimes once a year. So we can go in, do an inspection, make that home lead safe, and then the next 6 months they move to another apartment, right? This rental registry isn't going to discriminate with children. It's if it is a rental unit, it doesn't matter who's living there, it still has to be made lead safe.
so with the number of children that are lead poisoned, what percentage of those children live in rental properties versus owner-occupied properties? Do we know that?
It's a high, it's over 50%. I can guarantee it's over 50%, probably closer to 80.
So there's real no prevention in place for owner-occupied residents?
Yes, so we're able to and that's what will really shift our prevention efforts. So once we pick up this rental inspection to be focusing that team of people on rental, we can still go in and do prevention inspections. We can do single family homes. We can do owner occupied units. None of our programs discriminate rental versus owner occupied. We can do anybody's home as long as it's built before 1978 and there's kids, pregnant women.
But not as much for prevention. Like, this is strong.
Yes,
this
no,
is
we
strong
can,
prevention.
no, we can still go in and do prevention.
So let me back up a little bit. So we have 2 existing state mandated programs, our prevention program and our follow-up
Intervention.
and our intervention program. So those 2 programs exist. We've been doing them for quite a while. We're gonna continue doing them into the foreseeable future. This rental registry is a brand new thing that is just another tool being added to the prevention toolbox.
Good.
Yeah.
Thank you.
I don't know the answer to this, that's what I'm gonna ask you. How does a child get lead poisoning if the windows are painted with lead paint? Do they eat the chips or?
So if a window is painted, so our programs are really have refocused on friction and impact surface. So a window is a friction surface. So if you take it and you open that window 4 or 5 times, that paint's gonna rub through. So what it does is it creates a really fine dust. That dust, it's lead, it's metal, it's heavy, so it's gonna sink. Where is it gonna sink? It's gonna sink on the floor, or it's gonna sink on the windowsill. So as soon as a child crawls over, pulls itself up, they don't necessarily have to be eating paint chips to be lead poisoned. A good kind of visual and frame of thought. So if you took a sugar packet and you dumped it out and you took 3 grains of sugar, that is enough to elevate a child's body. So it is a very small amount of lead that can poison a child. So, I mean, while we do have cases where kids, yes, eat paint chips and they are a little bit higher, most of our kids it's just dust. And it's sticky, it sticks to their hands, it sticks to their toys, kids put everything in their mouth. So they're really ingesting lead dust.
No, I know,
Yeah.
thank you.
Okay. Anything else? All in favor?
Aye.
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 Okay, our next one, last one, authorize acceptance of New York State Homes and Community Renewal and Housing Trust Fund Corporation Leading in Lead Prevention Pilot Program and amend 2024 budget.
So the state, with the rental registry, they also allocated $20 million throughout the state for these communities of concern to apply for, so we can conduct remediation efforts and pay contractors to abate. So that's this portion of it. This is just the remediation portion of our rental registry money. And New York State has contracted with Homes and Community Renewal to administer that programs to our counties.
So it's a way to help fix the problems once we
Right.
find them.
Okay.
So, and the resolution doesn't indicate it, but this can only be spent in communities of concern.
So 80% of our units have to be conducted in our community of concern, in the 14701.
Okay, only 80% of this.
Right, so we can do a few homes a year that are outside of that, but it has to be a rental unit. So this money it has to be identified by the health department's CLIP program, and it has to be a rental unit.
Okay. On the HUD website, it doesn't indicate that. It just says it has to be for the community of concern.
Well, those are the parameters of the
Yeah.
program.
There's been a lot of webinars.
Well, they describe the pilot program in some detail, and
Yeah.
it just says just for communities of concern.
Right. So, yeah, because that goes along with the rental registry. The rental registry isn't statewide. It's for communities of concern.
So there are some counties that aren't gonna ever have the opportunity to have this funding.
Right,
Yeah.
right. Or the majority of Chautauqua County.
Well, yeah.
Well, we can always enact local ordinances to,
Right.
Make it right.
make it more uniform throughout the county.
Yep.
And include single-family homes.
For certain, can you do that with all you can't do that with all your grants though, right? You
We can have a
it's-
lot of local ordinances that
Really?
would,
That's interesting.
yeah.
I mean, I get the impression that what you're saying is, so like in an area where there was an incidence of polio that was really high, just to use an analogy, if there's an incidence of polio that's really high, they would come into, you would identify that as a really high-risk area, and you would treat it differently than other areas that are not as high risk.
Right.
And that's what you're saying about lead, that because Jamestown is so bad, or, I don't mean bad, but,
It is,
the
yeah.
issue itself is so prevalent
Yeah.
that they are treating it differently because it is such an issue.
Right.
Well,
Yeah.
they're focusing resources on, yeah.
And
Yeah.
that kind of makes sense, I
Yeah.
guess.
Yeah.
Is this 456, I noticed this is a 2-year?
It
term?
says 2-year, but a lot of counties don't have the program set up that we have already built between the county and COI. We have a HUD grant going, so it's going to be very easy for us to implement this money. For example, I already have all of the units identified and we're scheduling the inspections as we speak. So we're really ready to spend this money. Many counties aren't set up that way yet. So they either didn't apply for the money, or, they aren't going to be able to spend all of the money. That's why they gave us 2 years, is because so many communities weren't really set up. So what I'm hoping is that we're gonna spend the money because we have, a lot of need in our community, and then we could potentially ask for more money.
So we're ahead of the game.
Yes,
And this is 456,000.
Yeah.
For the 2 years.
yeah.
It's not each year, it's 2 years.
Eventually, it should be a yearly allocation.
Okay,
Yes.
eventually. Okay.
I mean, I'm pretty sure that'll be spent by the end of this year, but
Because we are,
yeah,
you are
yeah.
ahead of the game.
Thank you. Yeah.
Okay, any other questions?
I have just one question.
Okay.
So, given the fact that there obviously is lead incidents and a lot of older houses in the rest of Chautauqua County, and that people might be alarmed about, if you, can people who just are not in a target area call you and ask advice or an inspection, or can there be anything like that?
Yeah, through our prevention program, we can do any inspection as long as it meets that criteria. If they have an older home, the 1978, there's
Yeah.
children, pregnant women, or a rental unit, we can still do a prevention inspection there.
Yeah, we're buzzing around all over the county
All over
doing
the
this,
county.
yeah.
Okay.
Yeah.
Thank you.
Anything else? All in favor?
Aye.
Aye.
Thank you, folks.
Thank you,
Thank you.
guys.
Thanks.
Okay. Now we have a discussion. Now it's Lacey's turn.
Hey, Marty, want to sign up?
Wait, let me sign
Oh,
it.
sorry.
We have various updates with the health department and new state-level mandated services by,
Lacey Wilson from the Public Health Department. I am the Public Health Director. From what I understand, you're hoping that I will keep this going for another 45 minutes or so, so that we get.
At least.
Okay, no, yeah.
we'll ask planning and economic development.
No, so I am just really glad to be here tonight. I will keep this brief because I know there's other meetings and things to come in. And you all are the most familiar, of course, legislators, with what we do in the health department. Just wonderful timing that we had the resolutions here tonight. I do want to say thank you so much. Of course, a number of those were late. This is the first time for myself and some others in the department going through the resolution process. Very, very grateful for the finance team that helped us move this through. They probably don't want to have any other emails from me and asking these questions, but everybody was so gracious in the process, so thank you also for receiving those tonight. In addition to that, really what we are here to talk about is the fact that the health department, of course, with Dr. Falk, who is just a wonderful asset to our community in leading so many of the different medical provision things that we do that get a lot of attention in the media, to, COVID and different things like that. At times, I think it is a misunderstanding in the community that there's also a number of other things that we do. And tonight was a perfect representation of that, just in terms of the policy and systems environmental work that we do. So we know that you all, and this group in particular, have really been champions for that type of work for us. The lead rental registry and the lead programming that we already do, you all really have been ahead of the curve. If you didn't kind of hear that and what Anna and Jessica were saying, and the fact that we are really set up in a number of ways with the great infrastructure already in our health department to take on this type of work. The lead rental registry is this new mandated service, though, that will come down, and it is much more of a policy and systems level change. They did reference the FTEs that will be needed for this, but the state and the federal governments are really recognizing right now that the public health workforce and infrastructure has taken a hit over the last 10 years, specifically the last 5 years, if you know what I'm referencing. So they have really taken it upon themselves to infuse resources that have never been available to us before. So the FTEs that will be needed for the lead rental registry will come, and this is something that we don't get to say often, will be funded by the money that comes from the state in this rental registry. So that is something that we're celebrating within the department, but something, of course, that we want you all to be aware of, as we really consider you all partners with us. We understand that you are answering a lot of these questions in the community, and we want you to be equipped with as much knowledge and understanding of this so that you can inform our community members well and feel like you are equipped with that information. We do a lot of other things in the health department that I won't get into today. We do operate in 6 core service areas, over 50 programs and services that we offer, dozens and dozens of contracts and grants and things that we are really
tasked with through our Article 6, specifically Article 6 is what our state aid reimbursement, those are state aid reimbursed services. So that's really the largest amount of funding that we get from the state. But in order to get that funding, we have to provide the services that that funding is requiring us to do, is mandated to do. But there is a piece of that, once we exceed that initial base rate, they only reimburse us at 36% of the service cost after that. So that is typically where local share comes in for our department. But also timely in the conversation tonight, really what what Jessica and Anna were referring to when you were talking about local ordinances is unique to the health department is the sanitary code, the local sanitary code. So there is a state sanitary code and local sanitary code. The local sanitary code is really advised on and directed by the Board of Health, which Legislator Proctor is now a part of that board with us. And within our sanitary code, we do have the opportunity to really apply things in a more county-specific way in terms of enforcement and fee structures and things like that. So there is an opportunity there for some other revenue sources and things that maybe we haven't tapped into as comprehensively as we could. And also just some of that oversight to really ensure that we are covering things in a more universal and streamlined way. So that is absolutely up for discussion and something that you can reach out to me at any time, or of course Legislator Proctor is kind of the legislative liaison on the board. We are very open to those conversations and hearing from you as to what the community members and constituents would like to see us kind of move forward in that way. It is a great opportunity in the health department. We are really focused on collaboration. There's some discussions and things that we're having with the Sheriff's Department and the DA in terms of how can we come together and do these kind of monitorings and inspections and things in a more comprehensive and efficient way so that we're being really savvy with county resources, people resources and dollars, and just providing the most comprehensive experience for our community members. So there's also some wonderful things. I know Trish is here too, so a lot of wonderful things that we're getting to work on with mental hygiene, DSS. So while we are no longer with DSS in the health department, we're still really excited that we have such close ties with our other departments in a lot of those collaborative efforts to really just approach things again in a more comprehensive way. I spoke really quickly to try to get through this for you all, but I'm happy to take questions. And of course, like I said, this could be an ongoing conversation. Please reach out to me. We would love to offer to those of you on the Human Services Committee, but any of the legislators, to come to the health department. We can kind of give you a tour and a walkthrough of all of the different things that we do. We can set you up with going to visit some of our mobile health vehicle sites now. Our mobile health vehicle is out in the community providing services. We just do so much, and I can understand how probably overwhelming that is as a legislator to have to take all of that in. So whatever we can do to equip you.
How is the mobile health unit being received and utilized? And
So what we have done, again, to be really thoughtful with resources, is we're piloting this, specifically working with organizations and program areas in the community that are already up and running, in which people are coming to those sites for services, like the Food Express in downtown Jamestown, in the Save-A-Lot area up in the North County, where we know that there's a traffic of people coming. We're working through our community-based organizations to provide those dates and times and what services are offered at those locations, and those are just 2 in each of the North and South. There's a handful and throughout the county. It's basically Tuesdays and Thursdays, once or twice a month in both North County, South County. And really it was working with those community-based organizations to say what is most needed. Also working hand in hand with our partners at TCC, who also have a mobile unit. Those are federal dollars that we don't want to duplicate their services and what they're doing. So we worked closely with them in the planning to ensure that, we're working together and not duplicating. So services in terms of, we can provide immunizations, there's, screenings that we're doing. Yeah, there's a whole host of things, education, health education, sexual health education, those types of things. It has been well received so far, best practices being developed.
I wanted to second that, because that was something I had, several people said that the mobile health clinic is doing really well. I see here it's also in Brockton,
Yes.
so it's
Mhm.
going into some of these outlying areas where the lack
Absolutely.
of access is different than it would be in the cities. And it looks like there's a huge list. You're doing a lot of things, immunizations and breastfeeding support, blood pressure
Yep.
screening. I mean, there's quite the list, and I've heard a lot of good things about it.
Oh,
So I
thank you.
wanted to thank you and Dr.
Mm.
Falk for this great
Yes.
effort.
And I'm confident in saying that Dr. Falk would say the same, that it's really the team of people that we have, and the community-based organizations who have just been so, enthusiastic about this and welcoming us. Thank you for bringing that up too, legislator, that, I say our team has a more difficult job on their plate than a lot of other counties. We are this interesting mid-level county where we have 2 urban pockets and a number of rural areas and suburban areas around them. And so our team has to be experts in how you handle rural public health issues and urban public health issues. And how you do those things, they need to be approached in very different ways a lot of times. So, again, we can lean on, the expert help of our partners in mental hygiene, and DSS and OFAS is another one that we're working with a lot. So I would love to take credit for it, but it really is a collaborative effort.
Yeah.
Mhm. And I will say too, a plug for that is that moving into the fall, as we develop the best practices here, we will be working with the schools, because really the funding for this vehicle comes primarily from a school immunization effort to ensure that all of the kids who need and parents have consented to immunizations have access to them should they not be able to get to a physician's office. Of course, our first priority is that children are hooked up with a preventive care specialist and practitioner, but if for some reason they can't get to them in the time frame that's needed to get them in school, we'll come in and provide that safety net service.
Having worked in schools for many years, we had the mobile dental van come from UB multiple times, and, just in terms of coordinating all that, it's really doable in
Yeah.
a school system, and
Yeah.
it's a really great, it's a great way.
Yes, yes.
Healthcare delivery, yeah. Thank you.
We don't have the mobile dental anymore though, right?
We
UB discontinued that, didn't it?
Well, no, it is still in Chautauqua County. It is a regional, it's a tri-county system now though. So whereas before it was really primarily stationed, it still is primarily stationed in Chautauqua County, serves over 1,200 children a year in Chautauqua County still. It's a wonderful service, and we are continuing those conversations and working to ensure that that stays for a very long time in Chautauqua County.
And this is almost a similar model.
It's almost a similar model.
Yeah.
Mhm.
Okay, are there any other questions?
Thank you.
I just you said, are there any other mandated services from the state other than this lead rental and?
Lead rental registry, again, I just came from another meeting that I was, that I got called into, so I don't have my notes, so this was all from the top of my head. The other mandated services, I'm trying to think, did we have anything in, no, it wasn't you all. EI is the other one, so our early intervention and our children and youth with special health care needs. It's not that it's a new mandated service in particular, but it's a continuation of transportation for children and youth with special health care needs. That responsibility currently at the state level falls to the counties and the public health department in our instance. And so that is a larger budget
item from the health department. So there are discussions that are being had with advocacy networks at the state level to ask for some reprieve there, because it does become such a costly endeavor for us, and is something that typically we'll talk about during the budget process. We were hopeful that that may have changed before this budget year, but it doesn't look like that will be changing. So just another marker to say, we'll be talking with you about what that budget might look like. The concerns there are that during COVID, screenings for early intervention services weren't happening because they would have been done in person. So now we have kind of this catch-up couple of years that we're seeing where more students and more children are entering the system at one time than we've ever seen before. So there's a bit of an increase there that we had sort of expected, but you just don't know to what extent until those screenings start coming in. So our staff is doing a wonderful job rolling along with that, but some of those more out of our control costs, like transportation, does become a bit of an issue.
Okay. Anything else? Okay.
Thank you.
Okay. Is there any, well, we did other.
I wanted to bring up the meeting that was discussed at our last meeting, to have
Right.
a meeting between last meeting and this meeting with various stakeholders about the concerns that the CPS.
Right, and I know the county executive and Carmelo had a meeting with a bunch of those concerned stakeholders, and there was some resolution. I believe there were 6 people reassigned as caseworkers. Pierre, are you?
I did check on that. That's not what I was told in response to, you said that yesterday.
Yeah,
I checked on that, and I have some specific, I think truly that what we have is an opportunity to be helpful, and I think I spoke to, I've spoken to everyone on the committee about being helpful. We've had CPS workers come to multiple meetings and expressed a variety of concerns, and some of them are extremely serious, such as it's not safe, and particularly in Jamestown, in the city of Jamestown, that it's not safe to go into many of these homes. One thing that somebody told me yesterday was, for those, for those situations that you read about in the paper, where there is some child endangerment and guns and drugs, the CPS workers are the ones who are then going into the homes the next day. And I think I could go through a list of things, and I know we've heard many of these things from Child Protective Service workers. I know they've also spoken about their work week and various things, which it's very clear that that is not our, jurisdiction or area that we would discuss it. But we do have the ability, the legislature has the ability, I have this, the rules of the legislature, Section 2B provides that the legislature may from time to time create special committees. Any resolution creating a special committee shall specify the powers and duties of the committee and the number of its members. And then it also says there is no authority for standing committees like us to establish subcommittees. So what that would mean is, and I do have a resolution here that is, the other thing that it is also true in terms of presenting resolutions. Single legislators can present to the clerk for pre-file to be considered next week, the idea, a subcommittee. And so I wouldn't be so much, I think that the thing is that as a group, as a legislative group, we have seen
and heard of multiple things. And this is not in, and I think, you know, and I spoke with Chair Shagnon about this, and he advised that it would be really important that if we went into this situation, if we asked the legislature and the legislature voted to have a committee, a subcommittee, a special committee, we'd have to assign, and I do have that in the resolution, a number of people. We should have a time designated period to look into this. And it's not in any way a punitive thing, and as Chair Shagnon was clear to point out, and I know we discussed this, that this is an idea of being helpful. And I think as a county, because of what I've heard and what we've heard, there are concerns about safety of the children, particularly in Jamestown, and also of the workers. And in terms of litigation and looking for risks, I know several CPS workers said that they were concerned about their own private responsibility, and they personally can be, you know, be held responsible legally for various things. And so basically what we're hearing is a number of issues. I focus more on safety. I'm a nurse, I'm a social worker, I'm a mandated reporter for child protection. And so what I'm hearing is there are issues, and we really could be helpful with this. And so I do have a resolution that I was gonna give to Olivia. I suggested 3 people from our committee, and you could change that if you wanted. But it says, you know, I have the entire resolution and an individual legislator, and what I did was ask for Phil Landy, because he's a Jamestown legislator, you because you're the chair, and me because, you know, I'm a public health person, and also to the legislature to conclude its review and recommendations by December 31st. And I wanted to emphasize again that this is not in any way punitive, this is just an attempt to be helpful. So I would
Okay.
hope for, you know, people's support, legislators' support. If anyone has any comments, I'll give Olivia this. Thank you.
Okay, well, we look forward to that, so,
Any thoughts? I know we have all the,
well,
the whole planning and economic development here, but
yeah, I mean, I guess it would be consideration for the whole legislature at the next meeting to discuss and do that, so.
yeah, and I mean, just in terms of our ability to do that, we can.
Mhm.
And in terms of our responsibility to do that, you know, I think that would be a good way of being helpful in the same way, and at the same time responsive to some safety concerns.
Okay,
So, thank you for your consideration.
all right. Okay, anything else? We have a motion to adjourn,
Make a motion, we adjourn.
okay, second?
Second.
All in favor?
Aye.
Okay, thank you.
Sir?